So, what about the top priorities of NHI in certain communities? What would those be?
Well, I'll say this: we have a fairly developed primary healthcare system in Grenada. What you don't have are the services in primary healthcare. And I mean, you have a great vaccination program for school children. Those things work well. So what we have to do is to look at the things that work well and copy some of those things, because if you can't beat something that's working. So areas as one of the areas is logistics and distribution. Um, those are concepts in healthcare that could really make healthcare efficient. So take something as simple as blood draw. What you don't want to do is put a lab in every single parish, because the lab requires certification, quality, concentration of people. But if you just say put a lab draw station in every visiting station, and we at the end of the day send that lab down to the main lab, and I know some efforts are on the way to do that. Something as simple as that could help people. One of the things that when we were going around talking to people that we hear is that we get health care, then we get a prescription for lab, we get a prescription for pharmacy, we get prescriptions for supplies or whatever we need, and we have to take a day of work to get each of those things done. So one day you have to go draw the blood. One day you have to go get the pharmacy and the medication. One day you have to get some of the things. And then you may have to go see another doctor. Now, what that does, it for a man in the street who has his farm to take care of, he has to take the kids to school. They have all these things to do. That's a day of productivity that they lost. Okay, not to forget that they might be ill. So you got to bring healthcare to the people. And if you're able to, we have to sit down and redesign the healthcare delivery system so that those things are available. One of the ways we could do that, because again, it's very hard for a government to pull those resources out, because where the government get the sources from? It's from taxpayers. Okay, and the tax base is limited to a degree. So that's why in Grenada, for healthcare to work, we must have a private-public partnership. This is absolutely necessary. There is a lot of dollars, I believe, in this healthcare system that's wasted. And if we find a way to make the system more efficient, generally speaking, when you shift from a system that's traditional healthcare to a managed healthcare system, we know for a fact those systems save at least 15%. I think in Grenada you might be able to save more than that. But again, you have to put an administrative system in place that's governed by professional healthcare managers that understand how to manage healthcare. And that's how those measures are generally executed. The savings comes from, one, having an administrative system that does not duplicate. We have a tremendous duplication of effort in all of the Caribbean healthcare delivery system. We've proposed a model where through NHI, we have a centralized basis for management of the capital in healthcare. It's not just a single payer system, but what we do is money comes in from all the sources and goes out. So, for example, if an insurance company comes to Grenada and says, I want to provide an insurance product and I want a contract, they have to go to every doctor, every hospital, and sign a contract. For them, that's wasted resources, that's time. But if they come and we have an organized association of healthcare providers through the NHI, they contract with one entity. And that entity contracts with every provider. And that's what we're proposing here. So it cuts out the administrative bureaucracy so that every doctor, and think about how difficult it is. Right now, if you get healthcare in Grenada from just about any one of the insurance companies, you have to take the money out of your pocket, pay for it, and then hope that you get reimbursed, at least at the level that you think you should. Okay, because we have to shift from a reimbursement model to a payment model. This reimbursement model is unfair to the individuals, it's unfair to the people paying for the policy, and it has to change. That's the way you're going to make healthcare work. Through an NHI model, working with the insurance companies, we could create some fair systems, all right, in which all parties win. The insurance company wins, the consumer wins, and because now you have a responsible population of healthcare workers that's going to work according to the rules. If we do that, you're going to get efficiency. So it's not duplicative. And that's where we believe that we could cut administrative costs in the entire healthcare delivery system to somewhere between 12 and 15%. Total administrative costs just by doing this. So you have savings from administrative costs. You have saving from consolidation of the population, right? Where if everybody gets healthcare through a centralized mechanism, you cut costs. You also create a level of efficiency. Even for people that can't afford to pay for healthcare, having them in the system gives the system power. If I'm going to create a cardiovascular center in Grenada, the 30 or 40% of people that could pay for healthcare is not enough to support a cardiovascular center. You need the whole country. So you want to have the people that can't pay come to the cardiovascular center for care. Why? Because now you have enough population to be able to get the standard of care up, so that you have to have a certain amount of employee, a certain amount of cases, a certain amount of technician. So everybody wins in this situation, whether you could pay or not pay. So you need to have a system that's sustainable from a delivery standpoint by having critical mass. So we're presenting a concept of consolidation of the capital, the dollars that are available. When you consolidate capital in healthcare, you spread the risk across everybody. So if one person gets cancer, everybody's paying for it. Imagine one person getting cancer and have to pay for all of those services themselves. Rich or poor, that could make you enter into poverty. We have $90 million in Grenada that we are spending on out-of-pocket expenses, and maybe more than that when you consider international care. Having an organized system such as the National Health Insurance allows us to be able to capitalize on all those dollars that are available in the system in a way that's efficient. So you could create an efficient healthcare delivery system by consolidating the payers, consolidating the providers, consolidating the people.
Will all Grenadians be able to benefit to get healthcare? In other words, for those, like some of the questions that are coming in right now, for those who cannot pay or those who are unemployed, how will they be able to pay and to benefit under the NHI?
Well, again, the whole concept of national health insurance is to provide insurance or coverage or healthcare services to all people. And national health insurance gives us the opportunity to do that, just that. So all persons will have healthcare services under the national health insurance, yes. Those who are not able to pay will not be required to pay.
What about those who have a private insurance? How do the two of them tie in?
So when I earlier alluded the question when you asked me about the situation with how NHI is being configured to run and operate. One of the issues that we get from the private community, meaning the employers, you have some plans that currently exist, self-funded plans. These are different mechanisms by which people insure themselves. Many of those individuals don't want to lose their current health insurance benefits. So what we've designed in the model is that NHI will contract with many of these insurance plans to work with them. And so when care is delivered by the network of providers in Grenada, they will, through the NHI, provide payment to the providers for the services that are covered by those insurance plans. So we've created a system where that's possible. So what will happen is we are now bringing in additional revenues into the healthcare system such that individuals who have insurance or who want to have insurance or buy insurance have the ability to get care through the NHI. Now, we believe that all Grenadians, uh, from the services or the dollars provided through the government, there's a right that they have to be able to use the government resources to get health care. But we know that the resources available from the government are limited. So we designed the system such that even for the people that only depend on government resources, because we have ways of collecting additional dollars to fund the NHI, those people are going to be able to get a higher level of care than what they're currently getting that the government would provide. But by just including the private and public dollars in a way through the NHI, it will allow people to get more advanced care across the board.